Labyrinthitis is an inflammation of the inner ear labyrinth which can disrupt both balance and hearing. This condition affects the vestibular system, the crucial part of the inner ear responsible for maintaining balance. Labyrinthitis typically presents with symptoms of vertigo, dizziness, and sometimes hearing loss or ringing in the ear. Tinnitus causes viral infections. The most common cause of labyrinthitis, often linked to upper respiratory infections like the cold or flu. Bacterial infections, less common but can occur, especially following a middle ear infection, otitis media, or in more serious cases like meningitis. Autoimmune conditions. Rarely, the immune system may mistakenly attack the inner ear, leading to inflammation. Allergic reactions. In some cases, severe allergies can also contribute to labyrinthitis by causing fluid buildup in the ear. Head trauma. Direct injury to the ear or head may also cause inflammation in the labyrinth. Symptoms. The symptoms of labyrinthitis can vary depending on whether the infection is viral or bacterial, but common symptoms include vertigo, a spinning sensation, often worsened by head movement, dizziness, feeling unsteady or lightheaded, loss of balance, difficulty walking or standing due to impaired balance, hearing loss. Often in one ear, it may be temporary or, in some cases, permanent. Tinnitus, ringing or buzzing in the affected ear. Nausea and vomiting, commonly associated with the severe vertigo. Ear pain, sometimes present if there's a concurrent ear infection. Diagnosis. A doctor will diagnose labyrinthitis through medical history, reviewing recent illnesses like a cold or flu, and any ear infections. Physical exam, checking for balance issues, hearing loss, and other neurological symptoms. Hearing test, audiometry to evaluate the level of hearing loss. Imaging tests. In more severe cases, a CT scan or MRI may be done to rule out other conditions like a stroke or tumor. Balance tests. Electronystagmography and or videonystagmography (VNG) may be used to assess balance function. Treatment. Most cases of viral labyrinthitis resolve on their own within a few weeks. However, treatment aims to manage symptoms and treat any underlying cause. Medications. Antihistamines, to reduce dizziness, e.g., meclizine, dimenhydrinate. Anti-nausea drugs, to control nausea and vomiting, e.g., promethazine. Corticosteroids, to reduce inflammation in more severe cases. Antibiotics, if the cause is bacterial, for example, the bacterial middle ear infection. Vestibular rehabilitation therapy (VRT). Physical therapy exercises designed to improve balance and reduce dizziness by retraining the brain to compensate for the damaged inner ear. Rest and hydration. Staying well rested and hydrated is important for recovery, especially during the acute phase of vertigo. Avoid triggers. Sudden head movements, bright lights, and stressful situations can exacerbate symptoms, so it's best to avoid these triggers during recovery. Recovery acute phase. Symptoms like vertigo and dizziness typically last for several days to weeks. Long-term, most people fully recover within a few weeks to a couple of months, but some may experience lingering dizziness or balance issues. Complications. Chronic dizziness. In rare cases, people may experience long-term dizziness or balance problems, also known as chronic vestibular dysfunction. Permanent hearing loss. Particularly if bacterial infection is the cause, hearing loss may persist. Anxiety. Ongoing dizziness or vertigo can lead to anxiety or panic attacks. Prevention. Prompt treatment of ear infections. Treating middle ear infections early can prevent labyrinthitis from developing. Vaccinations. Vaccines for illnesses like flu and meningitis can reduce the risk of viral and bacterial infections that might lead to labyrinthitis. Maintain the healthy immune system. A balanced diet, regular exercise, and proper sleep can help lower the chances of developing viral infections that might affect the ear. Labyrinthitis usually resolves with time and treatment, but if severe or persistent symptoms occur, medical attention is important to rule out other conditions and manage symptoms effectively.